Good day everyone, my name is Justine Marie Alvarez, your student nurse from Riverside College. And today, I'm going to take the vital signs taking assessment. Before I'm doing this procedure, I already did my hand washing procedure. So the equipments or materials that are needed in this assessment is our stethoscope and our sphygma manometer for our BP taking, our digital thermometer for our temperature taking, our watch with second hand for our respiratory rate and pulse rate, and of course, our reminders notebook. So again, ma'am, good day. I am Justine, your student nurse, and today I am going to take your vital signs. So in this procedure, ma'am, I'm going to take your body temperature, your pulse rate, and your respiratory rate, and of course, your blood pressure. Is that okay with you, ma'am?
Yes.
Yes, thank you. We're going to take the temperature of the patient by our thermometer. I am going to place the tip of the digital thermometer under the axillary part of the patient. So ma'am, I am going to lift your sleeves. So now we are going to wait until a sound is heard indicating the registered temperature. So after taking the patient's temperature, we are going to place back the thermometer in its container. So after we take the temperature of the patient, we are going to proceed in her pulse rate and her respiratory rate. So the patient is now in the sitting position. I'm going to place the tip of my two fingers in the radial inner wrist of the patient. And I will use the watch with the second hand in counting the pulsation of the patient's heart rate in 1 full minute. So now, ma'am, I am going to take your pulse rate, and can I request for you to be in a relaxed position and place your left arm in the table. Thank you. are done getting the patient's pulse rate and respiratory rate, we are going to proceed in the patient's blood pressure. So the patient is now in the relaxed position, and now we are going to expose her upper part of her left arm. And now I am going to wrap the cuff snugly and smoothly about 1 inch above the antecubital space with the center of the rubber bladder over the brachial artery. Then I am going to palpate in the brachial artery until I will feel the brachial pulse. After I felt the brachial pulse, I will place the earpiece of my stethoscope into my ears and place the diaphragm of the stethoscope in the medial antecubital fossa where the brachial artery is felt. Then I will start inflating the cuff and determine the patient's blood pressure. After determining the patient's blood pressure, we're going to remove the cuff into the patient's arm and fold it neatly and return to the container. So we are done in taking the patient's vital signs assessment. Our patient's results are normal with the temperature of 37.5, pulse rate 82, respiratory rate 19, and our blood pressure 120/80. So that is all for our vital signs taking assessment.